Lauren, what you got for us?
Thanks, Jason. Today we're going to be tackling mental health because May is actually Mental Health Awareness Month. And joining me right now is Glenn Simpson from ECU. Thank you so much for joining us this morning.
Good morning.
Thank you. So first of all, talk about why is it so important that we not only recognize May as Mental Health Awareness Month, but also keep people informed about mental health.
Sure. Well, you know, mental health is part of health, right? So we don't have health without mental health. And Mental Health Awareness Month actually began 74 years ago in 1949 by an organization we know today as Mental Health America. Because even back then, Mental Health America was trying to advocate for people who struggle with mental illnesses. As we all are probably aware, there's a stigma attached to mental illness. And even with the pandemic and a lot more people talking about mental health related issues, both in ourselves and our kids and our families and friends, and with the courage of some high profile people coming out, so to speak, to share that they've had mental health struggles. And unfortunately, we've heard about high profile people that have died by suicide over the last few years too. Even with all that kind of publicity, if you will, and discussion, there's still a big stigma with mental illness. And statistically, we know that 1 in 5 adult Americans will suffer a diagnosable mental illness this year. So there's fairly high prevalence. So what we want to be able to do through Mental Health Awareness Month is bring that to the attention, because as I mentioned, mental illness is a disease.
All right, and so I know that you were just talking about the stigma, but there are still signs that people may see either in themselves or the people that are around them. What are some of the symptoms people should look out for?
Right, so that's a great question. And of course there are signs, but in some cases, as we can imagine, those signs are very obvious, both to the person and to the people that they love and around them and that sort of thing. In other cases, those signs may be very subtle. And so sometimes we hear about these tragic situations and people say, oh, he seemed like such a nice guy, or I never would have guessed that about him, especially when we hear people who die tragically by suicide, for example. So some of those signs may be more that we can see ourselves, but some of them can be a little, like I mentioned, a little bit more subtle. So what we want to look for is changes, right? So is it change in sleep patterns? Somebody who sleeps a lot isn't sleeping as much anymore. Change in eating habits. More obvious signs could be feelings of despair and hopelessness, and in some cases even suicide thinking. But what we really want to do, either looking at ourselves or our loved one, is there a change? So if there is, ask the question, is everything okay? And it's okay to ask. Sometimes we're afraid to ask people about their mental health.
Okay.
Because there's a stigma attached to that.
Yeah, right, yeah. Well, thank you so much, Glenn. We do have to wrap up, but if you do have any resources, you can reach out to ECU Health. They have plenty of things to help people out there. Jason?